Fertility, Colorado. Hello, everybody. Happy Tuesday. This is Dr. Magarelli from CNY, Colorado. If you notice, I'm a little bit tan. I had a few days off, and gosh darn, I feel really good. Glad to be back. Today, we're going to be talking about just Q&A. Q&A is just questions and answers. You got questions, I've got answers for you. Um, uh, Anything new? Let's see, Dr. Banerjee, again, thank you so much. He did a wonderful job of being, hey, Caitlin, Miss Puffer, love to see you. Hey, Vanessa. Dr. Banerjee did a great job of covering for me, as did Dr. Fink. I don't know why I say covering for me. They're doing all the work. Just wonderful, wonderful folks. Hey, Ashley, good to see you on live. And came back to everything was still there. So that was great. I had a chance to watch my wonderful wife, Dr. Diane Credenda from East Winds Acupuncture. She did the Ironman St. George 70.3. She did fantastic. She loves that sort of thing. Hey, Leanne, good to see you. Nathalie Bentley, hep, hep, hello. Sydney Edwards, good to see you. Hey, yay. And let's see if we have anybody on Instagram. I'm not sure we're doing much Instagram anymore, but essentially tell all your friends to jump over to Facebook or YouTube. Hey, Tiffany, good to see you. Hello. Today, let's see what else is new. Oh, yes, on the weekend, I did a talk for the Integrated Fertility Symposium on metabolomics. That's a topic which I'm near and dear to my heart. It's actually really dear to the title of my book, which is still in process, but it's essentially understanding how all of the components of the machinery of our metabolism play a role. And so my goal is to try to simplify as much as we can the concepts around nutrition. Again, everywhere, it's placing a big impact on fertility, especially males. Males are being significantly impacted by increased body mass, motility, morphology. Pregnancy rates are falling precipitously. Total number of sperm being created are significantly affected by how your man eats and the weight he carries. So that's something just to start getting us all aware of. That it's around 30% now of all of infertility is just simply a weight issue associated with the men. But we can help. We can all help. Amber, good to see you, my dear. Tiffany. Okay, so Amanda, what would be the purpose of using Neupogen and Gonalef for frozen embryo transfer? You would not use either of those. Well, certainly not the Gonalef for frozen embryo transfer unless you're planning to do a fresh. So in other words, if you're planning to do a retrieval and a fresh embryo transfer, yes. Hi, Brittany. Good to see you. Looking at embryo adoption versus IVF, looking to be a new patient, 40-year-old AMH of 2. Well, okay. IVF, Tiffany. AMH of 2 at age 40 is actually very, very nice number. I don't see anybody here on Instagram, so I'm going to kind of look over here to Facebook and YouTube here. Jane, hello from Hoima, Louisiana. Hoima. I hope I'm saying that right. Jana, not Jane. Jana, good to see you, my dear. The purpose of IVF is to collect as many eggs as possible and create embryos and then allow us to pick out the embryos that make the most sense for implantation. So either you can get a donated embryo. This is a gal who asked a question. This is Tiffany. But at 40, in our program, that's a typical age for a lot of our patients trying. So if you want to, great. Caitlin, yes, I'm looking forward to you. Amanda Ward, we was just in Colorado last week. We had a wonderful experience. Thank you so much. Please tell people on things like I don't know, Google reviews and things like that. Sometimes they can be not so nice. Jamie, my husband has very low motility and low count. What's our option? Well, depending on how old you are, Jamie, if you're in your 20s, you could try IUI. In your 30s, IUI, and then that doesn't work, IVF. But in your 40s, you probably want to do IVF. Marnus, hey, Dr. M. Neupogen has caused me severe red tiredness, and I'm concerned about triggering leukemia. Do not take it. Jan, I have my first consultation May 17th. Can't wait. God, May 17th is coming right up. Leanna, I had a tubal reversal surgery in June. Did not work. Sorry, I lost my left fallopian tube, but I have my right. As partially distal blockage. Will I have to have my remaining tube removed before I can start IVF? No, not as long as you don't have a hydrosalpinx. What size follicles contain eggs? I've seen 12 and up. Well, no, follicles are egg houses. The follicle size you want to hit is 17, 18, 19 millimeters in mean diameter. That's the number that gives you the best chance for mature eggs. But you got to balance that with ovarian hyperstimulation. And was wondering if it's normal to feel implantation for one pregnancy and not for another. Yes. Yes, that is absolutely true. First beta yesterday was 14. Yes, Amber. So I'll pray for Amber. Next one's going to be 28. Jamie, I'm 35. He's 32. Yeah, you consider IUIs, but make sure that there are not any other issues like your tubes or anything else. Crystal, I just had a failed retrieval. I'm so sorry. Hello, Rebecca. Amber, do follicles that are 12 millimeters? Oh, we already went through that. My first fresh cycle failed. Does CMA charge for a follow-up phone call? We charge for every phone call. For a consult, I mean, we charge for consults. So if you want to do a consultation on what to do, certainly, but I don't think it's very much. How long are you typically on birth control before stems? You don't have to be on birth control. That's just a timer. I just had a failed retrieval. Looks like my eggs made it to fertilization. See, I kept waiting until day 7. Not sure what that means. It just means that, Crystal, unlike some programs that stop at day 5 and get rid of the embryos that don't make it, we actually know, and a lot of programs know, that you can grow them to day 7 and actually get a viable embryo that's going to make a baby. Would you transfer 2 AAA, 3 AA embryos? It depends on how old you are, Kelsey. We prefer 1 embryo transfer. What should HG be for day 14? I don't have any idea, Jamie. That has to do with your lab. Should I do CBD without THC, correct? I don't recommend CBD. Some people do. I don't. I don't think there's enough known, but definitely without THC, that is not good. Is it normal to spot brown while stimming? Yes, you certainly can, Amber. And again, depending on if you're doing a fresh or frozen transfer, that may or may not have an influence. Tanya had 3 mature eggs, follicles, when tired and not okay. I don't know. Dr. Magdalene, you helped me get pregnant with my son. Okay, you're welcome. Hey, yeah, Amber. Oh, Amber, of course. See you soon. Rebecca had successful IVF at another facility with my son. Had an FET with my last embryo on 2/16. Ended in a miscarriage. Sorry. I have a consult on June 14th. I'm 40. What should I expect as a meeting with a nurse, nor a doctor? As I'm meeting with a nurse, not a doctor. Well, you're meeting with a nurse practitioner. Our practitioners are absolutely trained to do these new patient inputs. So yes, you should expect a comprehensive discussion of your history. Please send us all of the information from your previous cycle. Get it uploaded. Make sure you know if you have the most recent AMH, sperm analysis, those kind of things. That was Rebecca. Joanna, 3 failed transfers, no tubes, all 3 ended up. Laparoscope or normal. Should ERA be next step? Well, when we don't get implantation, I think about mistimed progesterone. So the endometrial receptivity assay will give us an opportunity to kind of time the transfer better. So that's one thing you can look at. Endometriosis, you said laparoscopy was normal. How about acupuncture? How about serovital? How about all the nutraceuticals we recommend? I'm 27, had a failed transfer with a 4AA, Kelsey. Yeah, you could do two. My consultation is in June. How soon after that would IVF start? It depends on, Jamie, how many things you have to get done. Elizabeth, I read that birth control before IVF actually can increase success of pregnancy happening, but not sure how long we'll have to take them. It doesn't, so don't worry about it. I don't know anything about giveaways. I don't know anything about that stuff. I apologize. That's kind of a financial thing. Amber, I'm on day 6 of stims today. I'm planning on a fresh. Okay. Oh, nice. I added letrozole at this time, planning on retrieval Friday. Great, Amber. Looking at embryo adoption. Tiffany, I answered your question already. I'm not quite sure what your question is, but yes, you could do either embryo adoption or IVF. Just make an appointment. How long do you do the stim before retrieval? It should be a minimum of about 9 days. That's really, but 9, 10, or 11 days is really kind of optimal for stimulation. Hi, doctor. What do they do if they find a scar tissue in the uterus? They fix it. They do it. They did or do it. This is Doriana. You might want to do hysteroscopy to fix it, not. They did a DNC, and that may have caused a scar tissue. Okay. All right. My HSG came back normal. Do you still recommend I have an SIS? Well, Devon, if you're doing IVF, I would recommend you do hysteroscopy if you can. Hysteroscopy. That's the. Hey, Amber. Hey, Amber, my love, on Instagram. This is my daughter's on Instagram. We're over hanging out on Facebook and YouTube, but it's good to see your pretty face over there. I'm waving back at you. Lachula, I triggered tonight for retrieval with me on Thursday. I want to do a day 3 fresh, but that would land on Sunday. We do not do day 3, so we can either do a day 2 transfer. I mean, we don't do Sundays, we do day 3s. So you could either do a day 2 transfer or you could do a day 4 transfer. Oh, hi, Amber. Jumped over here. Okay, glad to see you, my dear. Looking at embryo adoption. Okay, Tiffany. You could do either, just simply, Tiffany Young, just simply contact us. You have a good AMH, but whatever you want, we'll help you with. There's no right answer. Hi, Claudine from San Diego. Chris, my last retrieval at another clinic had 40 eggs. Holy mackerel. I carry muscular dystrophy, so I'm testing, which will eliminate some of the embryos. Does CNY try to get as many eggs as possible? Of course. No. We don't. I don't think anybody reduces stims by number of follicles. They usually do it to watch out for ovarian hyperstimulation. From 32 with tubes tied, if I'm 32 with tubes tied, which means you've been successful, I would recommend transferring 1 embryo. Ice Lopez, I have 2 small polyps. Yes, absolutely. They need to be removed. When is it safe? About 6 weeks after the surgery would be a great time to do the transfer. Devon, trying to understand, so no need for SIS. I should have a hysteroscopy for preconception testing. Yes, that is exactly right, Devon. Bella, I really wanted to do my retrieval this time, Dr. Mack. I wanted you to do it. Looks like you are all booked. Is there anything we can do? I'm all booked. Well, just ask for me. And usually I'm fine, happy to do it. My last FET in January was hatching blast. Could a lack of PIO cause failure? Yes, if you do not, that's a great sentence there. If you do not do your progesterone, I will guarantee you your chances for conceiving are extremely low. Elizabeth, have they done a hysterectomy? Okay, all right. Amanda, is an AMH of 6 good? Sure, it's actually very good. Claudine, receptiva came back abnormal, a score of being 3.6. Not quite sure what that means. Maybe that you have a likelihood of endometriosis. Lisa, is FET something that I can schedule on a day, or does it depend on results? You can't really say I want it Tuesday at 4 o'clock. You just can't. But it may be that we can get it within a day. Can a person transfer 2 embryos if they want? Can sign a waiver, Tiffany. Yeah, the recommendations are 1. Layla, I asked for you today, cycle day 3. Nurse said Colorado location is full. I think what you're seeing is that there's only a certain number of retrievals we can do per day, not per Dr. Magarelli. We have 2 docs that can do them. Amber, if levels of progesterone is good with just doing suppositories and oral, do I still need to do PIO? No, you do not. Natalie, my first consultation is next week. I'm new to all this, 33. My husband and I have failed 4 IUIs. Okay, Natalie, this term unexplained infertility, I tend not to use it because 99% of the time we find a reason. It doesn't matter what the name of the diagnosis is. You've tried, it didn't work. Can we try something better that may work? Absolutely, and we would be happy to do that. Because quite frankly, there are so many factors, and as more tests get done, you tend to find something, but it doesn't matter. We just need sperm, eggs, and a uterus. We can pretty much ferret out what the issues are. My husband had a semen test done, and they said he had things that were high and things that were low. It sounds like a seesaw. Can things that were high make up for things that are low? No, it does not work that way. It's not a mathematical equation. Any one factor, and we look at three of them, the count, the motility, and the shape. Any one factor can significantly affect all the factors. Any two factors will significantly affect more. And if you have three factors, this is called Oates syndrome, oligoasthenoteratozoospermia. It actually can affect a lot and kind of pushes you towards IVF with ICSI. If you're monitoring from afar in Pennsylvania, does that still count as being in-house since it would be at CNY? I have no idea. No, I think you mean if you're in Syracuse, Albany, Rochester, Atlanta, or Colorado Springs, you're in-house. Can you use Provera to start a cycle to do in vitro? Absolutely. Is there a link between Raynaud's syndrome and infertility? You know, Cheyenne, I would suggest that it does have an immune component to it, a vasculitis component to it. And given immune and vasculitis play a big role in the implantation and fertility, I would say likely yes. Yes. Yeah, thank you. Hey, Jessica's back. Hi, Jessica. Maritza, my sister is my egg donor, trying to figure out if we should do fresh or frozen, advantages of fresh versus frozen. Well, you're going to be doing frozen because of the coordination factor. So, and there is no particular advantage of one or the other unless you have PCOS or problems with estrogen. Salias or Salias. I take estrogen and progesterone to cycle due to hypopituitarism. Should I stop in planning for cycle? No, you should talk to the nurses. They'll get you all, they'll get you all coordinated. Jamie, there is no CNY in Pennsylvania yet. Okay, ERA cycle. My lining is at baseline. Day 2 of my cycle was 7 millimeter, which seems a little thick. This is a mock cycle, but I wanted to do my best. Any suggestions on what I could do? Well, it is a little thick. You may wait a day before you start. What's the longest you can do the Benadryl, Pepcid, and Claritin? There's no studies. There's absolutely no studies. So what I would suggest is try to take it in coordination with your transfer. That's really what you want to do, is take it in coordination with your transfer. Don't be on it for months and months and months. All righty. If a cycle of IVF isn't successful, is there any discounts for starting again? Absolutely not. Okay. And then how long does it usually take once the biopsy? I always say 2 to 4 weeks for the biopsy results. Everybody says 7 to 10 days, but again, then you're going to be disappointed. Then you're going to make phone calls. Give us 2 to 4 weeks, and then we'll know what you have. Destiny, I've been priming for 8 days and I've been spotting and still have headaches. I'm sorry. I went from 6 yesterday, went to 5. Should I go down? I'm planning on being on it 2 months. Yes, go down, but be consistent. Quick thought on natural FET cycle struggling with lining thickness. Well, Vanna, if you cannot get the lining right, unless you do a natural cycle, there's nothing wrong with doing that. Okay, well, let's not do any more conversations about in-house. If you guys have questions about what you're going to pay, just simply call the financial folks. They'll tell you exactly what you're going to pay. So please do your best to use these forums for medical kind of questions, because I actually don't know the financial questions. Can you explain low-dose naltrexone in IVF? Well, it's an anti-inflammatory in a sense. It's used, there's an opioid relationship with the implantation. And so the principle or the theory behind it is this opioid antagonist will somehow make receptivity better. Again, not a lot of data. Giza, when should you start IVF when breastfeeding without cycles? 25 years old, 2 months after you wean. Currently 12 months postpartum. As soon as you wean, give it 2 months and then you can start up, especially if you're going to do a fresh transfer. How long after trigger shot is given is IUI done? Within 24 to 48 hours. All righty. My cycle is 28 days. I'm priming now, and day 29 is my cycle delayed due to the priming meds. Is it the estrays? Yes, of course, Morgan. That would definitely play a role. In your priming, you should also, you may not have ovulated, so you may need medications to, depends on the reason for your priming, but you may need medications to start a period. Is I'm still confused on why hysteroscopy was suggested with no irregularities, because the HSG is only 75% accurate on detecting masses inside your uterus, whereas the hysteroscopy is considered the gold standard, as close to 100 as you can. So that's the reasoning for it, is it's the gold standard. Everybody's answering each other's questions. I struggle getting my lining to reach a 7 with estrogen patches and estrays, and vaginal are about 4,000. What else can you do to thicken lining? To consider traditional Chinese medicine. That certainly, and if you go to a certified infertility acupuncturist, they may be able to do herbs. But it's very difficult to change the lining. You might consider PRP washes, because that has been shown, but again, very little data. My last AMH was 2.45. Okay, I'm 38. I've done 2 AIs. I think at this point, IVF is your better choice after age 35, because it turns out that IUI and sex are about equal after age 35. So you're not really helping much with IUIs after age 35. Might as well go on vacation and have sex versus doing IVF. Is it possible to do an ERA and retrieval in the same cycle? No, because the whole purpose of getting your uterus perfectly primed is not to do it. It's to do it with frozen embryo transfer, and it's not to do it when there's other things going on. So you want to have everything controlled. And ERA is, what is ER is egg retrieval. My third egg retrieval is this Friday. My lining, blah, blah, blah. So ER is egg retrieval. All right. So you're having irregular periods, Jessica, now. Sounds like you're not able to time them. Just get an ultrasound, make sure there's not something else going on. And again, I forgot age and AMH and all those other things. It could be just simply an anovulation issue. Okay, is it normal to have a long cycle after your IVF cycle? Sometimes. This is my second month post, and I have a positive. Oh, but today's okay. Hold on. This is my second month post our first IVF cycle. So you didn't do anything this month, and you were positive on cycle day 16. Did you do an HCG or anything? Yeah, so I'm not quite sure why you're positive, unless you're doing some sort of treatment, or you might have gotten implantation and it stopped. Nathalie, 43 and starting IVF treatment in July. When do I start my Serovital? Today. Serovital is a growth hormone secreted God, good for men, women, good for egg donors, good for gestational carriers. It really is all related to the value that you put on making a healthy body a fertile body. So Serovital is just something you could pick up at Costco, or you can get it online. And what it does is it increases your own body's production of growth hormone. Now that's required for egg development, sperm development, endometrial lining development, many factors within the body. And as we age, we get less and less of this. So that's certainly something you can do. Joanna, can you explain ERA? Well, an endometrial receptivity assay is just a way for us to biopsy the lining of the uterus when we expect the implantation window to be open. And it will tell us, even up to a certain number of hours, when your optimal implantation window is, so that we can time how much progesterone you get before we put the embryo in. It could be, normally it takes 6 days of progesterone for you to have the window open. But some women it takes 4 days, some women it takes 8 days. So what this does is it finds out for you when is your optimal time for the implantation window. if my estrogen is almost 7,000 and 5,300, the second, would using letrozole keep my E2 down enough during stims to get a fresh? It's not just your, this is an important point. Just because you take letrozole and it tricks us into not seeing the estrogen that you're making, right? Does not mean you're not hyperstimming. And the reason we don't do fresh transfers is from the body standpoint, the hyperstimulation is influencing the hyperexcretion of estrogen because it's still excreting estrogen, you're just not seeing it. Or you're seeing less of it, does not mean it's making a better lining. So if your Ella is elevated, then I would rather do a frozen embryo transfer. And then again, there's no difference between the two of them. What are your thoughts on endometrial scratching? The data now does not support, any data now, does not support that it helps. Huge studies have been done, New England Journal of Medicine, Cochrane studies. It just doesn't show any improvements in outcome. So the large groups of data say it doesn't do anything different. So what you want to do is, you know, if you're thinking that's the reason you're not getting pregnant, certainly you can get it done. But I am yet to find, or nor does the American Society for Reproductive Medicine consider it a tested, demonstratable treatment. What is your opinion on seeing chiropractors and acupuncturists to aid with fertility, Dia Yang? We strongly recommend traditional Chinese medicine in the form of acupuncture. We've done studies, Dr. Credenda and myself, we actually created the Credenda Magarilli acupuncture protocol. So essentially, the issue for me is why aren't you all doing acupuncture, since it's been shown to be a very cost-effective way to increase birth rates, reduce miscarriage rates, live birth rates. It's just great. When you start meds for IVF, what days would monitoring happen? It just depends on your schedule and where you're getting them done, usually on day baseline, then days 3 or 4 or 5, then days 6 or 7, then days 8 or 9, then days 10, 11, something like that. Are there symptoms with endometriosis, pain, irregular bleeding, or no symptoms? Is there a way to get your acupuncture protocol? Yes, absolutely. Contact Diane Credenda at eastwindsacupuncture.com and have your acupuncturist contact her and ask for the protocol. We're happy to give it. Can we get your oh, we already did that. What causes early ovulation during IVF procedure? I'm 43. The being 43, Jamila, we know that there's a irregular hormone patterns at the beginning at menarche between the ages of 9 and 13 and over 40. Everything in between tends to get stable. And that's just a function of your own hypothalamus pituitary ovarian axis aging out, basically. So one of the things we can do in those cases is start you on a GnRH antagonist called citrotide or ganirelix early. So you can start as early as day 3 or 4 so you don't ovulate. It's not guaranteed, but it can help. Is late implantation a bad thing? No. 36-year-old AMH of 0.38. Of course, I've forgotten the question, Jessica. Irregular periods. Yes, the AMH being low could cause you to start having irregular periods. It's called the perimenopause. It's just a name. I'm 40, AMH of 2.6. My husband's sperm is amazing. No such thing, by the way. Don't get caught up in male-oriented words like amazing. There's no such thing. It's either normal or abnormal sperm. I had all the tests done, been labeled unknown. Well, no, I'm sorry. By being 40, by definition, you have an age factor causing you to have infertility. Should I explore this or go back to IVF again? Well, Rebecca, this is bigger than that. You know, this is bigger than that. It's not just AMH, but it's age plus AMH plus sperm plus uterus plus history plus diet plus nutrition plus, you know, there are many more things to look at to answer the reason why things don't work. if all three major factors are low in semen analysis, what can be done to improve them? Avoid alcohol, tobacco, street drugs, and hot tubs for men. That means no alcohol, no marijuana, no vaping, no smoking, no alcohol, even avoiding high doses of caffeine. That's problematic. There's a stack of vitamins, zinc, CoQ10, omega-3 fatty acids, a good male vitamin. You can look it up on Molecular Fertility. GNC sells them. There's lifestyle, enough sleep, enough fluids. Many things can be done that are contributory, and make sure he's been evaluated by a urologist. Can you take DHA and Serovital? Yes. Should I get checked for endo, Christy? Just to make sure. Well, sure. Especially if you're having implantation issues. If I had a bad reaction to Menopur on my retrieval, you got to finish the sentence, but we'll find out. And if I had a bad reaction for my lister, should I try a different medication this time? I'm not quite sure what bad reaction is. Please tell us, because I'd like to talk about it. Melissa, I'm on day 10 of my cycle after my COVID shot. Will it get back to normal next month? Yeah, there's some interesting stuff. There doesn't seem to be any data suggesting that it affects the menstrual cycle. And then I was just reading that they think it might, but again, I don't have a lot of information about that. Okay. Do you recommend a stool softener during stims, and which one? Have GI distress days 5 of stim? Kia. Yeah, I just talked to the nurses. They're pretty good. Oh, Jesus, Allison, chest pain and elevated D dimers. I don't believe that's a Menopur issue. I think you need to be seen by a cardiologist, or at least your primary care. That is very atypical of any reaction to a gonadotropin I've ever heard. HCG-LH gives better results than Menopur? No. They're about equivalent. There's no one over the other. Nicole, my lining was 15 at ERA yesterday. Is this a good lining for a mock? No, it's a good lining. No, 15 is fine. So get the biopsy, see what it says, and if you're in sync, you're in sync. That's just who you are. You can just trust that. Okay. You're welcome, Allison. The alternative to Menopur is HCG-LH. So for every vial of Menopur that you took, which is a 75 unit vial, is about a 10 IU of HCG-LH. So if you were on 300 of Menopur, then you would be on 20 of HCG-LH. Kelly, you're yelling. Endo removed from 3 areas despite taking LDS. Low dose. What is LDS? Don't know. For a year, should it be increased? LDS, low dose. I don't know what LDS is. Sorry. Nanu Desiree. What is your opinion about doing duostim? If you have cancer, I think it's appropriate. If you're a regular patient and you're able to do 2 separate stimulations, you will get more eggs doing that by doing 2 separate. Yeah, tell me what this LDS 4.5 milligram. I'm not Latter-day Saints. I don't know what LDS is. Sorry. Oh, low dose naltrexone. Is that what you're saying, Kelly? Yeah, that would have nothing to do with endometriosis. I mean, it's not going to, it is not, low dose naltrexone is not anything that's going to change your endometriosis start, stop, or anything else. It has nothing to do with that. Duostim is where you, Kylie, is where you get 2 egg retrievals every 30 days rather than just 1 every 28 days. And so immediately after you take the eggs out, you start to stim up again. But you always tend to see fewer eggs than if you were to do 2 separate IVF cycles. So in other words, do your IVF cycle, optimize it, get off that, have a bleed, do another IVF cycle. You tend to get more eggs, more embryos, better outcomes. Don't worry about it, Kelly. I just wasn't sure what LDS. Everybody uses initials for everything, so I wasn't 100% sure what it was, to be honest with you. Okay. All right, I'll take some more water now. Okay, I had 10 eggs retrieved and ended up with 3 embryos. Failed transfer. So Dr. K recommended me to do duo stem. Okay, good. What advice do you have for low AMH? I have experienced 4 miscarriages, and the last embryo was tested with chromosomal issues. I also took progesterone during the pregnancies. Typically, the miscarriages happened 1 to 8 weeks. I'm 42. Okay, so what advice do you have for low AMH? You mean, how, Bria, do you get pregnant? Persistence and perseverance. It seems like you get eggs, get embryos. You just have to find normal ones. Definitely do the acupuncture. Definitely do a low carb eating. Oh, Kelly, I think you're telling me I'm old, right? You weren't yelling, thought it was easier for me to read. Thank you. Yeah, I guess I do look old, so I guess you might as well all do in caps. Oh, God. I had a consultation April 20th and haven't heard from the travel team. April 20th. So that's less than, that's what is today's 10 or 15 days. Well, it's 2 weeks after your consultation. Then you'll get connected with the financial. Then you connect with the travel team after that first 2 weeks. Is there a huge difference between a frozen teaser versus fresh? No, not really. Not in a good urologist, not really. Anna had baselines today that counted 27 follicles. What can I do to keep them from overstimulating? Well, Anna, just make sure. No, make sure you monitor your estrogen, monitor your follicle growth, talk to them about it, ask them questions like, do you think I'm going into ovarian hyperstimulation? If you do think that, then I would consider going to the acupuncturist for the management of ovarian hyperstimulation. If there isn't one close to you, then go to www.aborm.org, ABORM. If there's someone closer to you, like our Healing Arts Center, go there. Start proteins, about 200 grams of protein a day. That helps mitigate some of the problems. Okay. It's okay. I was only kidding, Kelly. What is the ideal length of time to take a high HGH? Well, 30, well, actually, probably 90 days. Not everybody does that, but certainly 50 days. So 2 months is probably, if you're asking the ideal time, yeah. Any HCG boosters and wash can help with implantation. Okay, someone's answering a question there. Or can it? Yes, it can. It can. Not good data, again, but some data. You have to be self-advocate at CNY. They've always been extremely helpful with everything we need, but we need to reach out and tell them our needs. Help them help us, guys. Elizabeth, that couldn't be a better truth. You know, yes, we get over 30,000 phone calls a day and over 30,000 requests for care a month. We have 44 people on the phones 24 hours a day. And honestly, we're doing the best we can. But yes, be a self-advocate, not a continuous advocate, but, give yourself reasonable times. You're not going to get it within an hour. You may not get it within a day, but certainly within 2 or 3 days of a contact, you should get a contact back. Hubby on Jessica on Clomid and HCG. Great, to repair. Do we know the percentage of finding sperm the first time? Hubby was baseline varicocele and azoospermia. And do you know why he had azoospermia? I don't. So if it was it's not a vasectomy. So it's a 70% chance, typically, if you don't have an unknown reason for azoospermia, that you'll find sperm. And it's about a 98% chance of finding sperm if the reason you don't have sperm is because of a vasectomy. So if it's for unknown reasons, figure about a 75% chance that you'll find sperm. If it's for known reasons, like a vasectomy, then it's probably 95 to 99% chance of finding sperm. So pretty darn good. When do you predict to see the benefits from ovarian PRP, Kelly? Well, Kelly, you have a lot of questions. So that's good. It helps everybody. So PRP, platelet-rich plasma, growth factors. We need them, and we need them as we get older. And depending on the influence of those on neovascularization or on growth or ovarian growth factors, if you're gonna see an effect from the treatment, it's gonna within the next 1 or 2 months. That's so treatment. Maybe you'll see it the next month. Maybe you'll see it the month thereafter. Not a vasectomy. Good. Okay. So you have probably about a 75% chance that you're going to find sperm. How to help eggs mature is culture long enough, 17, 18, 19 millimeters in mean diameter. You want to culture at least 9 days, 9, 10, or 11 days. Those are the ideal. That's the best you can do. As a healthy 30-year-old, is mini IVF or standard better? I would not do mini IVF for anyone unless they had low ovarian reserve. I would not do mini IVF for anyone unless they had low ovarian reserve. It's just a funny name. Minimal stimulation is like saying not enough food. The typical protocol for a 30-year-old, the amount of gonal F is already the right amount. So, 225 of gonal F and maybe 30 of or 20 of LH. That's what I would do. You want to do conventional. That's my opinion. How long do you do the lipid infusions? Well, up to 12 weeks. Some people do it throughout the whole pregnancy. What protocol, Sonia, would you use for a poor egg quality in a 45-year-old? Mini. I would probably use mini because you're not going to get a lot of eggs, but I would definitely do the acupuncture. I would definitely do Serovital. I would definitely do growth hormone. Is CNY in Buffalo closed on Sundays? My understanding is every CNY facility is closed on Sundays, but you might call to find out if somebody knows. Is 30 millimeter egg size follicle, not eggs, follicle size normal, Jamila? It's not normal or not normal. It just depends on the group of follicles that you have. Elizabeth, I do always want to know who won the grants. I'm inpatient in the area. If it's not me, okay, yeah. So Elizabeth, I don't know anything about winning or losing or contests. I'm honestly not involved with that, nor do I know anything about the financial side. I'm really here about the medical side to help you guys as much as I can answer questions, make you feel heard, and learn something, because I tend to learn a lot. You're welcome, Amber. You're welcome. If we were to do another retrieval, I would want to prime for a month or two with stim meds to boost egg production. Would I prime with a standard dose of gonal F? Yes. Jessica, if your goal is to get maximum priming, and that's not the right word, it's sort of a gonadotropin stimulation test. And what it does is it can and may make populations of follicles available. What's the oldest patient you treated with their own eggs? Probably 48, 50, 48, 50. I wasn't asking, really sorry, just saying it's something I enjoy. Oh, okay. Okay. Oh, I love the contests. I think the contests are great. I thought you were asking about the results and who won. No, I don't know that stuff. But yeah, no, I definitely enjoy that. Okay, Claudine. I got 2 ovarian PRPs done at CNY in August. One in February. 44 just turned 45. It improved my AMH to 1.28 from something, I guess, which is the highest in 4 years. We also see more follicles at baseline. There you go. That's what we call an N of 1. She had the experience. She's sharing the experience. If that's the experience, then there you go. And some people, that's what they need to know, is that other people have had a good experience with it. And good. I'm glad that that was positive for you. Okay, so again, the issue for folks is, can I get the egg quality issue is always hammering us on what do we do for egg quality? Well, avoiding alcohol, tobacco, street drugs, taking appropriate supplements, not every single supplement known to God. A good above the ground vegetable diet, the greens, the broccolis, the kale, the Brussels sprouts, asparagus, the celery, the cauliflower, meats that are unprocessed meats, unpackaged foods that are actually from the grocery side, not the boxed food side. Hydration. Okay, Mandy. First FSH did result in a positive beta. I'm sorry, so biochemical. Frozen failed. For third transfer, what do you recommend? Well, Mandy, if you're at CNY and you've done the various protocols, make sure that your uterus has been evaluated within the last 6 months. Make sure that you maybe want to do an ERA, an endometrial receptivity assay. Make sure you've been evaluated to see whether or not you may have endometriosis. Make sure you're doing their acupuncture. Make sure you're doing your serial vital. Make sure you're doing your growth hormone. Silvana, thank you very much. I love answering questions. It's funny. It's hard on the voice because I tend to want to answer them all. If we are definitely doing birth control for whatever time they tell us, do we still get a baseline? Yes, you do get a baseline before the stimulation. Not that's what you need is before the stimulation, not before the birth control pill. Prednisone was part of my medical regime. I did very poorly on prednisone. Can I forego or replace it with another steroid? How important is the prednisone? So Sarah, yes, you can forego it. It's an adjunct. Do you think embryo glue helps, Kimberly? You're asking a hard question. I'm a little bit torn as to whether it helps or not. But I think, just so you know, at CNY, it's part of the embryology suite of care. We just provide it. It's not something you have to ask for. So there's no downside from doing it. Do you have any pre-ER egg retrieval or transfer rituals or good luck charms, Anna? I do, actually. I'm a big proponent of traditional Chinese medicine, and maybe that's ritualistic. I do really feel that experience puts you in a different place. So I think it's kind of good luck, although I think it's good medicine. I think walking with your husband for 20 minutes a day or your partner for 20 minutes a day, holding hands and visualizing your child is really a nice ritual. Bring something that is meaningful to you. Like when I do your retrieval or transfers, I give you a picture. Well, take that picture, bring it to your acupuncturist and hold it over your womb while you're getting your treatment. So again, rituals. Christy, 41-year-old AMH is 2.4. Is that considered average? It's actually good, Christy. So at 1.2 is probably average for a 41-year-old. Maritza, my egg donor has had an IUD. Does she have to get it taken out? Egg donor? No. Nano. When priming, should I stop the meds, estrace, prometrium, omnitrope to get my period? Not the omnitrope, or do I have to continue until my period starts from a new IVF cycle? It depends on your treatment. Some people can do it continuously, but no, don't stop your omnitrope. But if you want to bleed, if you're planning to have cyclic bleeding, then you have to stop the estrogen and progesterone. Is ICSI possibly bad for eggs, not for embryos? Because you use ICSI to make an embryo. Possibly bad. Yes, there's some suggestions that it may have a negative effect, but most of the studies show it has a positive effect. So the vast majority of studies suggest it has a positive impact on live births, which is what you want. It's 30, yeah. We're getting a little bit more data saying it's not all that great, just like everything else. It goes in waves, meaning it's not as needed as we think. What size do you normally take the eggs for retrieval? You're talking about the follicle size is 18, a mean diameter of 18 plus or minus 1. So 17, 18, or 19. That's kind of my sweet spot. That's been my sweet spot for 30 years. It seems to give us the vast majority of matures, fewer immatures, and almost no GVs. So I kind of do the 17, 18, 19 is kind of my little way of doing it. So how many days before should I stop estrace and prometrium to get my period? You should talk to your nurse about your protocol. Okay, just talk to your nurse about your protocol. They will be able to tell you, because I don't know your protocol. I don't want to give you a date or a time that I don't know. D. Munoz. So you've had one transfer. Well, If you're 20 years old, it takes 2 to 3 transfers to make a baby. 30, it takes 3 to 4, and of course 40 more. So it's if it's untested embryo, then you're probably at a 15 or 20% chance of success. Do you recommend bed rest after Kimberly? Yes, I actually do. I recommend rest that day, rest the next day. Anyone traveling to see me from out of state, I will tell you, do not, and I can't tell you enough, do not schedule your flight out the same day as your transfer. Things get behind, and we just can't shift your time. It's not good for you. It's not good for your embryos. It's not good for anything. So rest that day, rest the next day, and you can go home, the next day. But if you're traveling out of town, I strongly recommend you rest that day, rest the next. It's been a long haul. In 1 month, good enough for my sister to take Serovital? Yes. And her cocktail of something? Yes. Good enough? Yes, Maritza. I'm terribly torn, 41-year-old, with do I do fresh or frozen? Well, how many embryos did you make? That's the answer. If you make 4 or more embryos on day 3, then do a day 5 transfer, fresh. If you do less than, do a day 3 transfer, fresh. There is no advantage for you unless you have OHSS to do frozen. None. Unless you hyperstim, of course. Yeah, please. Yes. Thank you, Jessica. When you come to Colorado, guys, you're not going to be able to breathe. I mean, we're at, a mile high city. So keep yourselves well hydrated. You are going to be on baby aspirin. Yes, get a little bit acclimated. You need oxygen. And I'll tell you what, man, don't expect you're just going to show up and run up a flight of stairs. You're not. The elevation is too high. So exactly as Jessica said, definitely, just definitely give yourself a couple of days. There was another question. What's the follicle count and harvest relationship? So if you have 16 follicles, 70% of them should have an egg. Let's make it 10 follicles, you should get 6 or 7 eggs. So for every 10 follicles, if you're in your 30s, you get 6 or 7 eggs. If you're in your 40s, you get 3 or 4. Okay? Can IVF still work for someone who has cervical stenosis? Yes, it can, but if you have cervical stenosis, how are we going to get the embryo in there? So we would have to uncervical stenose you, which is just a closing of the cervix. So we'd have to do a surgery. Before I forget, we're growing at CNY Colorado, so we definitely need more reproductive endocrinologists. So if you know of any brothers, sisters, cousins who are reproductive endocrinologists and want a great job with great benefits, come out to CNY Colorado or any of our CNY facilities. We are definitely looking for them. We're definitely looking for more nurses, for sure. We're hiring nurses. We're hiring medical assistants. We're hiring embryologists. So we're growing remarkably. So I figured I'd throw that out there because all of you are related to somebody. Maybe someone's looking for a job, and we would love to get a couple of more reproductive endocrinologists so we can do more patients. Would the surgery to correct the cervical stenosis be performed before the IVF cycle process? Nope, you can do it after. You'll freeze your embryos. If you do it before, then you might be likely to be able to get a fresh transfer. Okay? So if you do it before, but again, I'm a real proponent of save the eggs, make the embryos ASAP, because those are your limited resources. Your very limited resources. So you want to make embryos, put them in the freezer. Those are future babies. Uterus doesn't age up to age 74 or even older. So I would strongly recommend making your embryos before you do your surgeries. And this way you have those little baby sickles in the freezer, okay? We are looking at education for health fields, and embryology is hard to break into, huh? We are looking at education for health fields. No, embryology is not hard to break into at all, Elizabeth. Get a science degree, a Bachelor of Science. Get a job. You could work with cows. You could work with animals, any kind of cellular biology. I agree, Jessica. Banking eggs. And by the way, all you grandparents or no grandparents, the best gift to give a high school student is egg freezing and sperm freezing. That is the absolute best. Egg freezing and sperm freezing is instead of a car for graduation in high school, freeze their eggs, freeze their sperm, because like you, they're going to mess around in college and mess with stuff that's going to affect their eggs and sperm. And by freezing eggs and sperm, then they don't have to worry about time. Jamila, I would love working with you, but unfortunately I live in Australia. Okay, Jamila. Well, wonderful. Well, I would like to work with you too. I have a consult July 13th in Colorado. I'm excited to start the process. Christina, we are too. I got to tell you, Dr. Fink is doing fabulous. My nurses, by the way, wish every nurse happy Nurses Week, please. Happy Nurses Week. Our nurses are the heart of every IVF practice that we have, so please wish any nurse especially our nurses, our travel nurses, our local nurses, our nurses that handle the phones, our nurses in the procedure room. Thank them for being such good caregivers. They're just wonderful. It's a tough job. It's harder than mine. Yeah, anyway, so there you have it. Another wonderful week that we've been able to sail through. I sure it was good. It was fun. It was good questions. There's a lot of opportunity for us to help. There's a lot of opportunity for you to help yourself. I believe a healthy body is a fertile body. I think Jessica put the link for downloading. Thank you, Brittany, for downloading the Family Building Guide. It's also on Amazon, so people can buy a copy of it on Amazon or download it on our website. Follow the directions. Look at our resource page. Our resource page describes everything, so you don't have to be afraid of anything. Just go there. It'll give you a lot of good information. Again, don't be afraid. Invite people to these. We have 8 or 9 lives during the weekend. They're all different. We're all just gosh darn different doctors, different chefs, different cooks. Some people stress one thing over another. We even have naturopaths and DOs. We've got a cacophony of doctor-sounding names out there that are here to help. We're always learning. A lot of the things we do are optional. They're add-ons. They're additions to the standard because the standard sometimes doesn't work. And you're welcome, Caitlin. My pleasure. The standard sometimes doesn't work. So what we try to do is to offer options. These are not mandatory ever. None of the things that we recommend, aside from what's required, like gonadotropins and GRNH agonists or something like that, they're not requirements. These are things that you look about, think about, talk to others about. Not a lot of data. They're just things that we just feel like there's enough data and there's been some reports that show that it can help. So why wouldn't we want to help? Claudine, it's my pleasure. Jana, my pleasure. For all of you, happy Mother's Day or Mother's to Be Day. It's coming very soon. Make sure you send something to your mommy. Please tell the nurses thank you Nurses Day week. Thank you nurses for being so wonderful to all of us, especially to us doctors and to you patients. And have faith. Gosh, that gets us through everything. As I said, my wife did a 70.3 mile Ironman, and she just believed in herself, and it was tough. 97 degrees temperatures, mountain passes, ice cold water, but she just believes. And one step, one stroke, one foot in front of the other, and that's what you do with fertility. Is you just move ahead. So I'll say bye to everybody. Kisses to everybody. Bye, Amber, if you're still on. Love you. And I will see you next week. I'm not sure what I'm going to talk about, but I'll have a topic next week. So just check the Facebook for the topic if you want, and the website. Anyway, have a wonderful evening, everybody. And thank you very much for being a part of my evening. Thank you.